what are the best things to do after removing a cancerous tumor? So what's the best thing to do after surgery really is the question. If I have surgery and I have a cancer diagnosis, what should I do? Well, I made a video, it's a blog post. It's on dealing with surgery. There's a new study that just came out that actually confirms something that I've said 100 times, that we don't want to have elective surgeries if we can help it when we have a cancer diagnosis. That's why I've been told, I've told you guys multiple times that I'm not a big fan of, okay, I had mastectomy because I had breast cancer, but now I'm going to have surgery to have breast implants. And I understand I'm not a woman and I don't know what it's like to have to not have breasts and all the emotions that go along with that. But when we perform a surgery of any kind, even to remove a cancerous tumor, the way your body has to heal itself is to upregulate IGF-1. Remember, IGF-1 is your growth hormone initiator. So IGF-1 levels are how you heal. So if I even cut myself, how do I heal that cut? IGF-1 levels are upregulated, meaning increased, and that stimulates an increase in that mTOR pathway. Remember, we've spoken about that ad nauseum. So when we upregulate the mTOR pathway, it increases my ability to heal. That wound is scarred over, and I heal nicely and go, wow, look at I healed so well. That's wonderful. But you did so by upregulating mTOR and IGF-1 pathways. When you upregulate mTOR and IGF-1 pathways with a cancer diagnosis, it is, I hate to say it, but it is like throwing gasoline on a fire. So we want to do things to downregulate the mTOR and IGF-1 after surgery. So the best way to downregulate mTOR and IGF-1 is through fasting. But I'll say it again, cancer patients cannot fast more than 24 hours at a time if we're talking about a true water fast. That's why we talked about doing intermittent fasting, or what's called time-restricted eating. So you actually are fasting every day, but it's only a fast of maybe 16 to 20 hours a day. If your time-restricted eating is limited to 4 to 8 hour window. If you're eating within a 4-hour window, which would be a pretty tight time-restricted eating window, that means you're fasting 20 hours a day, which would be a great thing for cancer because you'll have downregulated IGF-1, downregulated mTOR, downregulated PDKs. You could get the same benefit by using the fasting mimicking diet. So you go on the fasting mimicking diet 5 days a month, and you stick to the diet that we put you on, you're going to have downregulated IGF-1, downregulated mTOR, downregulated PDK. You do not want to go on a water fast for more than 24 hours if you have cancer, because it'll upregulate IGF-1. The only exception to that is if you're doing chemo and you're going on a water fast the day previous to the chemo and then the day of chemo. It's a lot of information. If you have questions, you can post another question on Facebook, rewind this video and listen to that again. The best way to heal from a surgery, if you have cancer, is to try to downregulate, keep a handle on IGF-1 and mTOR, and you do that through the fasting mimicking diet. That answers that. That will help. So if you have more questions on that, feel free to call or to ask on Facebook.